Good day. This is the Emergency Rescue Unit Foundation. For today's lecture, we are going to discuss the Basic Life Support course. In this course, we will learn how to recognize cardiac arrest, provide high-quality CPR, use of an AED, and manage choking incident. Before we start, here are our course objectives. General objective. After the 2 hours training of Basic Life Support, participants will acquire knowledge, enhance skills, and develop attitude in rendering basic emergency procedures. Specific objectives. First, determine important parts and functions of human anatomy involved in cardiopulmonary resuscitation. Second, list at least 5 vital signs and its normal parameter. Third, discuss the concept of basic life support. And fourth, demonstrate basic life support procedures. Let's start with our anatomy. There are 2 main systems that are involved in our cardiopulmonary resuscitation. Let's discuss first the respiratory system. The respiratory system is the system of the body that deals with breathing. When we breathe, the body takes in the needed oxygen and expels the carbon dioxide. Here's a video of the respiratory cycle.
The respiratory system moves air through the nose, pharynx, larynx, trachea, and bronchus to the alveoli where the gas exchange between oxygen and carbon dioxide occurs. Nares are the openings to the nose. The nasal cavity is lined with cilia, mucous membranes, and blood capillaries. The air is filtered by cilia, moistened by mucous membranes, and warmed by the blood. Air moves into the pharynx or throat, the common passageway for food and air. Air continues on to the larynx. The epiglottis, a flap of tissue in front of the larynx, closes off the larynx when swallowing to prevent food from entering. The larynx or voice box contains the vocal folds. The trachea or windpipe connects the larynx to the bronchial tree. The cartilage rings of the trachea prevent the trachea from collapsing. Lungs are spongy tissue with alveoli and blood capillaries. Breathing occurs because of the expansion and contraction of the lungs. The bronchi carrying the air subdivide into smaller branches called bronchioles. At the end of each bronchiole are the alveolar sacs. The alveolar sacs are surrounded by blood capillaries and contain millions of single-layer alveoli cells where the gas exchange takes place. Oxygenated air goes from the nose to the pharynx, larynx, trachea, bronchus, and alveoli. By the process of diffusion, oxygen in the air moves from the alveoli to the capillaries. Carbon dioxide moves from the capillaries to the alveoli and is exhaled. This process is called respiration.
We breathe air. Atmospheric air is composed of 21% oxygen, 78% nitrogen, and 1% other gases. Focus on the oxygen. Only 5% of it is utilized in our body, while 16% is exhaled. Next, the circulatory system. There are 3 organs involved in this system. The heart, which pumps blood, the blood, which is the transport system of oxygen and nutrients, and the blood vessels, which serves as passageway of blood. A typical person has around 45 liters of blood. The blood is the transport system by which oxygen and nutrients reach the body cells and waste materials are carried away through the blood vessels. And the heart, a muscular organ that is about the size of your clenched fist and is located at the center of the chest slightly tilted to the left, is responsible to pump that keeps this transport system moving. Here's a video of the systemic circulation flow.
This animation illustrates a single cardiac cycle, starting with the right side of the heart. In reality, of course, the 2 sides of the heart work together at the same time, but it is easier to understand if we look at them separately, because each side of the heart has a different function. The cardiac cycle begins as deoxygenated blood flows from the body into the right atrium via the superior vena cava and inferior vena cava. In the next phase of the cycle, the right atrium contracts, pumping blood into the right ventricle through the tricuspid valve. Once the right ventricle fills with blood, the tricuspid valve closes to prevent blood flowing back into the atrium. The right ventricle contracts, forcing the pulmonary valve to open as blood is pumped into the pulmonary artery. Blood then travels to the lungs and the pulmonary valve closes, At the same time, the right atrium relaxes, ready to accept the next intake of blood. In the lungs, the blood picks up oxygen and releases carbon dioxide. Oxygenated blood flows from the lungs into the left atrium via the pulmonary veins. The left atrium contracts to pump blood into the left ventricle through the mitral valve. Once the left ventricle has filled with blood, the mitral valve closes. Next, the left ventricle contracts, forcing the aortic valve to open, allowing blood to be pumped into the aorta and from there around the body. The aortic valve closes to prevent blood flowing back into the left ventricle, and the left ventricle relaxes, ready to accept the next intake of blood. Cardiac cycle is now complete.
Normal vital signs. Vital signs are clinical measurements that indicate the state of a patient's essential body functions. It has 4 components: the blood pressure, pulse rate, respiratory rate, and body temperature. In respiratory rate, we use the unit CPM that stands for cycles per minute. The normal range for respiratory rate for infant is 30 to 50 cycles per minute. For child, 20 to 30 cycles per minute. For adult, 12 to 20 cycles per minute. We take the respiratory rate by putting our hands just above the abdomen of the patient or look for the rise and fall of the chest. Inhale and exhale, count as 1. Count for full minute. In pulse rate, we use the unit BPM that stands for beats per minute. The normal range for pulse rate for infant is 100 to 120 beats per minute. For child, 80 to 100 beats per minute. And for adult, 60 to 80 beats per minute. We have 9 different pulse sites: temporal, carotid, apical, brachial, radial, femoral, popliteal, posterior tibial, and dorsalis pedis. We palpate pulse using our index and middle finger. For blood pressure, the normal range is 100 to 150 mm mercury for systolic, over 60 to 100 mm mercury for diastolic. The systolic pressure is the contraction of the heart, and diastolic pressure is the relaxation of the heart. You may notice some normal range differences between the hospital and pre-hospital setting. You may notice the borderline of 150 over 100 mm mercury because patient in an accident may have heightened emotions. BP is also expected to be high. For body temperature, the normal is 37 degrees Celsius. Let's go to basic life support. Out of hospital adult chain of survival. The American Heart Association formulated this chain of survival with the components of basic life support. First, recognition and activation of the emergency response system. In recognizing cardiac arrest, patient is unresponsive, no pulse and not breathing. And activation of emergency medical service, that's the time you're calling for help. Second, immediate high-quality CPR. Third, rapid defibrillation, using automated external defibrillator or AED. The first 3 are for lay rescuers. Fourth, basic and advanced emergency medical services. It is done by the emergency medical service or emergency department. Fifth, advanced life support and post-arrest care. It is done by the emergency department or ICU and cath lab. The chain must not break for us to give the patient high chance of survival from cardiac arrest. BLS concepts of adult chain of survival. First, immediate recognition of cardiac arrest and activation of the emergency response system. Second, early performance of high-quality CPR. Third, rapid defibrillation with an AED. Fourth, effective advanced cardiac life support. And fifth, multidisciplinary post-cardiac arrest care. CPR sequence. CPR stands for cardiopulmonary resuscitation. Components are compression depth of 2 to 2.4 inches, compression rate of 100 to 120 per minute, allowing chest recoil, compression and ventilation ratio of 30:2. According to American Heart Association, they change from ABC, which is airway, breathing, circulation, to CAB, which is circulation, airway, and breathing. Because according to research, it has been tested that initiating chest compressions before ventilations can have higher chance of survival for the patient on cardiac arrest. That's why we initiate chest compressions before ventilations. CPR. We should assess using the mnemonic CABD, that stands for C. Circulation. Is there a palpable carotid pulse? For unresponsive patient, always check the carotid pulse. Second, is the person bleeding severely? Compressions are not effective when the patient's blood is spurting every compress. A. Airway. Does the person have an open airway? Check if the person can't talk. It means the airway is blocked. We have 3 ways on how to open the airway. We use head tilt chin lift, jaw thrust maneuver, and crossed finger technique. B. Breathing. Is the person breathing? Look for rise and fall of the chest. D. Defibrillation. Is an AED or automated external defibrillator available? AED can only detect 2 shockable rhythms, namely the ventricular fibrillation or VFib and ventricular tachycardia or VTAC. Other types of AED. Main components of CPR. First, chest compressions. Give 30 proper chest compressions. Second, airway. Open the airway using head tilt chin lift or jaw thrust maneuver. Third, breathing. Give 2 rescue breaths. CPR flow. First, scene size up. You have to check patient surroundings 360 degrees. Second, check for patient's responsiveness by saying,
Hey, are you okay? Hey, are you okay?
on both ears to check for bilateral deafness. Third, call for help. You call an ambulance and get an AED. Next, check.
You ma'am wearing blue shirt, can you call 161 or any ambulance service? We have unresponsive patient here at Mantawi Drive, Mantawi City. You sir wearing white shirt, kindly get an AED if available and come back to me.
Next, check for carotid pulse and breathing. Locate the carotid pulse and observe for the rise and fall of the chest, not more than 10 seconds. If the patient has no pulse and not breathing, immediately start high-quality CPR. That is 30 compressions is to 2 ventilations for 5 cycles. After 5 cycles, you have to recheck pulse and breathing, not more than 10 seconds. If still no pulse and not breathing, give the patient another set of 5 cycles. If the pulse and breathing are present, place patient in a recovery position. Pediatric Basic Life Support. Infants are defined those who are less than 1 year old, and children 1 year old to puberty. Pediatric Chain of Survival. The components include: first, prevention; second, early CPR; third, prompt access to EMS; fourth, PALS; and fifth, integrated post-cardiac care. In prevention of cardiac arrest, babies and children often had respiratory problem before cardiac arrest. That's why it is very important to educate the parents, especially nursing mothers, of the proper way on breastfeeding their infants to prevent aspiration. In early CPR, for infants and children, if there's only one rescuer, observe the 30:2 ratio, that is, 30 compressions is to 2 ventilations. If there are 2 rescuers, observe the 15:2 ratio, that is, 15 compressions is to 2 ventilations. In prompt access to EMS, that's the time you call for help after initial CPR. In pediatric advanced life support, it is done by the emergency medical service or emergency department. In integrated post-cardiac arrest, it is done by the emergency department or ICU. Again, remember that breaking the chain of survival, CAB, or circulation, airway, and breathing, have lesser chance of patient's survival. BLS concepts of the pediatric chain of survival. First, prevention of cardiac arrest. Second, early high-quality bystander CPR. Third, rapid activation of the emergency response system. Fourth, effective advanced cardiac life support. And fifth, integrated post-cardiac arrest care.
Hello, sir. We need help. We have an unresponsive baby at Mantawi Drive, Mandawi. I'm doing CPR right now. Hey, are you okay? Hey, are you okay? the gray shirt, can you go get an ambulance? We have an unresponsive patient at Mantawi Drive, Mandawi. Ma'am, with the white shirt, can you go get an AED and come back here for feedback?
When to stop CPR. Remember the mnemonic HELP. H stands for help arrives. That's the time the ambulance arrives. E, exhausted. The rescuer becomes exhausted. L, life appears, if the patient shows signs of life. And P, pronounced dead, if the patient is declared dead by the medical doctor. Critical times for saving a life. During cardiac arrest, if the victim's heart stops, it also stops to supply oxygen to all parts of the body. And the brain has only 4 to 6 minutes tolerance of hypoxia. That's why the rescuer should start CPR and calls EMS. If we fail to perform chest compressions right after the heart stops, more than 4 to 6 minutes, brain starts to damage, and this is irreversible. We can restart the heart, but the brain is damaged, so the patient will be in a comatose state. Within 10 minutes, emergency medical service arrives and begins advanced care. The stages of death. There are 2 types of stages of death. First, clinical death. This occurs when a patient's heartbeat and breathing have stopped. Second, biological death. Permanent end of all life functions in an organism or part of an organism. This displays obvious signs of death. For example, decapitation. This means beheaded. Rigor mortis. Stiffness of the body after death occurs 3 to 4 hours from clinical death. Decomposition. Process of decay starts 24 to 72 hours after death. Lividity or livor mortis. Settling of blood on the dependent areas of the body may start 20 to 30 minutes but become obvious after 2 hours of death. We also have adjunctive devices. Adjunctive devices are used to help in opening the airway of the patient. For the mouth, we use the OPA or oropharyngeal airway, and for the nose, the NPA or nasopharyngeal airway devices. Next, let's go to respiratory emergencies. Most commonly happen when the airway becomes obstructed in some way. We have 2 types of airway obstruction. 1. Anatomical obstruction. Part of the upper airway organs are the cause of obstruction. When the back of the tongue drops down into the throat, or when tissue in the throat swells caused by injuries. 2. Mechanical obstruction. Occurs when the airway is partly or completely blocked by solid food and fluids like vomitus, blood, or saliva. We also have common causes of choking. 1. Trying to swallow large pieces of poorly chewed food. 2. Drinking alcohol before or during meals. Alcohol dulls the nerve that aid in swallowing. 3. Eating while talking excitedly or eating too fast. The epiglottis is a leaf-shaped flap of cartilage located behind the tongue. The main function of the epiglottis is to seal off the windpipe during eating so that food is not accidentally inhaled. Remember, don't talk when your mouth is full. 4. Walking, playing or running with food or objects in mouth. Common, especially in children. 5. Wearing dentures. Dentures make it difficult to sense whether the food is fully chewed. Signs of a foreign body airway obstruction. We have mild airway obstruction and severe airway obstruction. Mild airway obstruction or partial airway obstruction, patient can make incomprehensible sounds and awake. While severe airway obstruction or complete airway obstruction, patient is awake but cannot make sound and may become unresponsive if no management. What's the universal sign of choking? It is clutching the neck with one or both hands. Let's go to choking relief for responsive adult or child. We perform abdominal thrust or Heimlich maneuver with the victim standing or sitting. For pregnant and obese victims, we perform chest thrust. Next, choking relief for unresponsive adult or child. When the patient becomes unresponsive, begin 30 chest compressions and remove any object seen in the mouth, then give rescue breaths. Now, choking relief for infants. We give 5 times back slaps and 5 times downward chest thrusts. So this is a summary of high-quality CPR components for basic life support providers. Above all, do no further harm. Once again, this is the Emergency Rescue Unit Foundation. Thank you and good day.